Well, we understand that a new diagnosis of breast cancer is devastating. When the patient comes back to us after her biopsy, the radiologist that performed the biopsy will meet with her and go over the results with our Nurse Navigator. At that appointment, we introduce a Nurse Navigator who has made all of her appointments for her. There's no need for the patient to go home and worry and not know who she's going to see or what will happen. When we give her the diagnosis of breast cancer, we also give the entire path to cure. So they have all their appointments made for all the specialists they'll need for an absolute comprehensive care of the breast cancer. The Nurse Navigator will guide the patient through the entire treatment process. She makes the appointments and then follows up with the patient after every appointment and makes sure that everything is going smoothly. All the information gets distributed to all the physicians that are taking care of the patient. These physicians include the surgeon, a radiation oncologist, and a medical oncologist that will be seeing the patient not just for the treatment of this breast cancer, but also in follow-up. The Nurse Navigator often becomes such a close friend of the patients because of her interactive role with them throughout the entire process. The breast cancer program here at Ogden Regional Medical Center is a fully comprehensive program designed to take care of the patient in a very friendly, compassionate, and scientifically excellent way. The team is composed of experts in their fields of surgery, radiation oncology, and medical oncology who meet together at a tumor conference to discuss every single case before a decision is made as to treatment. The patient has a chance to consult with all of these people before definitive treatment. Between the time of diagnosis and the actual surgery, it typically takes about 2 weeks, while all the information is gathered about the patient and the breast cancer, and all the consults are had with the experts, so that the best possible treatment plan can be made, not just to treat the current breast cancer, but to avoid any recurrences. The Nurse Navigator is indispensable in this role because she's the one that will make the appointments and mediate the appointments to make sure that everything goes smoothly. The patient never has to worry about making appointments or making sure that the information is distributed correctly. She has enough to worry about with the breast cancer. We take care of everything else for her. We also have a full array of services for support and kind care to patients with breast cancer. We have monthly breast cancer support groups which meet, and these are patients that are either in treatment or have gone through treatment that meet in order to support and give information to new patients and to be a community of survivors. They're usually very, very positive, and this is a great experience for patients to be able to ask questions from people that have actually had the disease and had the cure. In addition to the breast cancer support groups, we offer yoga, which has been demonstrated in multiple centers to be very good at relieving anxiety, at helping patients with the whole process, at maintaining flexibility, and reducing the risk of lymphedema. We are planning to offer dietary and additional services to make sure that there's every possible facet of the patient's care is taken care of here within our breast cancer program. There is, to my knowledge, not another program as comprehensive within the state of Utah. In order to make the process a little bit easier, we also offer a breast cancer buddy program. And what we do is, with the patient's permission, we allow them to have contact with the patient in their same age group that has undergone treatment. Again, it's different for me to talk to the patient about what they'll go through because I've never had breast cancer. But if they can communicate with somebody who's been through the process, they can allay a lot of their fears and they can answer their questions in a way that I can't possibly answer. And this is a part of the comprehensive treatment that we offer. If you have been diagnosed with breast cancer, we want you to be sure that you understand that you're being treated in the most comprehensive and compassionate way possible. We do this every day, many times a day, but everyone is unique and individual.